Okay. Hello and welcome. My name is Jennifer Arnaiz from Montgomery County Department of Health and Human Services, and I'll be your host throughout this event. I'm very pleased to share this event with our childcare community. We are excited to engage with all of you. Today, we're going to talk about the Early Care and Education Initiative. I'm so incredibly proud to be able to share with all of you today all the achievements and what our plans are. For today's event, we will provide a recap of where we started, then move to our accomplishments over the past 4 years of our Early Care and Education Initiative. This recording is only part one of this conversation. To develop the next 4 years, we need you, our subject matter experts, to guide and provide insights and priorities. After this recording, you'll have an opportunity to participate in part two, which will allow you to engage, have dialogue, and share your opinions related to this topic. I will provide more instructions at the end of our recording on how to register. Before we get started, I'd like to express my sincere appreciation to you, our early care educators. You are all here because of your dedication and commitment of our unified vision. All children deserve the opportunity to thrive and learn in the best settings possible. Your passion unites us, and the energy we create is what allows us to achieve our individual as well as our county's goals. We need you as much as you need us, and that is why we are so appreciative to have you as part of our Montgomery County community. I'd like to welcome Bibi Otero, who serves as Special Assistant to our County Executive, Mark Elrich. Ms. Otero provides strategy, advice, and direction on a number of issues, including early childhood education and immigrant rights and services and education. Welcome, Bibi.
Thank you very much. Thank you for having me.
It's so nice. So let's take a step back and discuss how the initiative came about. Bibi, can you share with our viewers some of the decisions that motivated the creation of the Early Care and Education Initiative?
Well, absolutely, and welcome everyone. And hopefully this will be informative and help you kind of begin to think about where we go next. When Executive Elrich was elected, he made a commitment to early childhood education, as did many of the members of the county council. And so one of the first things that the first initiatives that we embarked on was this Early Care and Education Initiative as a joint effort and a joint investment between the executive and the council, and with a number of tenants. So we'll discuss what those were, but that's really where it comes from, and with an intent to really look at the issues of early care and education from a systemic approach rather than a programmatic approach. And that, I think, is a really important kind of marker for this initiative.
Great. So can you tell us a little bit about how the needs for our initiative were determined?
So, we really, as you all know, we have a very strong early childhood services program within HHS, an entity within HHS. And so really using the resources already available to us and the connections to community that the early childhood services already has was a real plus for us, including the ECCC and some of the associations, to begin to reach communities of providers and of parents to tell us what the needs were and what was currently needed in order to move our system forward.
Great. So in terms of goals, how were these established through the initiative? How was the action plan created?
So the action plan had the executive and the council set up a steering committee, asked us to set up a steering committee. We made recommendations. It's made up, again, thinking about it from a systemic perspective. We really brought in folks who touch early childhood in one way or another without not necessarily being folks who were providing direct service, and wanted to make sure that we were looking across the system, whether it's finance office, whether it's the fire marshal, whether it's folks working on facilities, as well as folks in the community through our stakeholder meetings and through direct surveys, et cetera, to try to reach out and gather as much information so that the steering committee could then synthesize that information and put it into a format that was digestible in some ways, and we were able to then set real targets in terms of what the work over the 4 years would be.
Great. So I heard you talk about various agencies such as permitting, HHS. The principal leadership of this initiative consisted of many public and private entities. Can you share a little bit about who were the decision makers?
So well, I feel the steering committee as a whole is really a decision maker. We have an executive team that purposely is made up of the executive, the council, Montgomery College, MCPS, Montgomery Moving Forward, and forgive me if I've forgotten someone, but those that made up the executive committee that then really was carrying out the expressed wishes of the steering committee that had already collected the information from the community. So really trying to make sure that this was a collaborative effort across the board.
So let's talk a little bit about what the initiative did. Can you give us a high-level overview of what the initial 4-year action plan for the initiative consisted of?
Absolutely. There were, at the end of all these conversations, as I shared, we came up with 5 sort of top-level issues that are cross-cutting. Again, looking at all the various organizations, agencies, and entities that are involved in this work. And I'll briefly describe each of them. There are 5 of them: sustainability, access and affordability, alignment, expansion, and monitoring the Maryland blueprint for education that was in the midst of development. The Kerwin report was in its the Kerwin committee was in process when we started this, and we wanted to make sure we monitored that to make sure that we understood how it would impact our early care and education work. Under sustainability, we wanted to ensure that both family and center-based programs were strong. We wanted to reduce attrition. We noticed that we were losing some programs, and this is all pre-COVID now. This is 4 years ago, and we were also losing available seats. So we wanted to make sure that we focused on what it would take to sustain programs and to ensure that we continue to have the services available for families and children. I'll come back to what we had to then switch to as it regards to the pandemic as it relates to sustainability. But part of sustainability, of course, was making sure that we had scholarship programs at Montgomery College, for example, so that folks could do their CDA, their AAS, and so on, so that they could stay on the field and move forward. Under access and affordability, we wanted to increase access to for more children and increase utilization by parents, in particular to our working parents assisted program. And so one of the things you will see under access and affordability is we increased the rates of WPA. And there was a significant increase in rates for WPA from, I'll give you an example. I think from infants, we went from 1,300 to 1,600 and so on. And we also increased the eligibility so that more families were eligible for the WPA. So that was a really important piece around access and affordability. And the other is having a communication strategy, and that communication strategy would then make sure that we were getting out to more parents and helping people really understand who we are and who we as a community of early care and education are. And we also reinforced the staffing within the Office of Early Childhood Services to make sure that there were supports internally also for our providers and our families. Under alignment, again, I shared to you what was the steering committee. So under alignment, it was really this cross-agency work that we were looking at to identify and resolve barriers to expansion, to access, to sustainability, and try to break through what some of those barriers were. And you'll see how that really impacted how we were able to work during the pandemic, because we had already begun to work on some of those issues around alignment. And around collaboration across departments and across agencies. like in many other systems, you had people who touched early childhood who'd never met each other. And so really trying to make sure that how is it that the work that you do impacts child development centers, and then some of the barriers that get created by having different policies or procedures are in place that sometimes even contradict each other, that affect our child care community. The fourth was expansion. We wanted to expand the availability of early childhood seats. We really wanted to focus on infants and toddlers in particular, but also preschoolers. We had partnerships with MCPS, where MCPS increased the number of preschool seats in key areas of the county. We were really trying to look at making sure that in the county we looked at areas where there might be pockets of where these services were not available. We looked at our early Head Start and our Head Start and the gaps that may have been there for especially 3-year-olds who were finishing early Head Start and could not get into our pre-K programs because there are lags in their birth dates. For those of you who know early Head Start and preschool. So we funded those gaps that existed. There weren't a lot of children there, but enough, every child counts. So that was really an important piece. We increased, for example, the access for pre-K from 186% of poverty to 300% of poverty. So those are the kinds of things we were doing around the access and affordability piece for families, and increasing the number of spaces available. We grew our family involvement center. We added a family involvement center in Gaithersburg, and so we have in Rockville and in Gaithersburg. Those are really geared towards those families who are either staying home with their children and would benefit from a connection with a early childhood professional on a regular basis, or maybe someone who was a nanny or a caretaker of children, but also for those families whose children were enrolled in the infant toddler program for children with special needs that needed a place to meet up with their specialists. And so that's what these family involvement centers were really key, and trying to make sure that we got to that. The other was expanding seats very specifically, and we made a strategic decision to focus in particular to expanding family childcare home, the number of family childcare homes. And I think we came close to 900 new seats in terms of expansion. Kudos to the Early Childhood Services team, because they really were created cohorts of folks, help them get through the licensing process, and then move on to begin to provide services. And of course, we know COVID hit and there were some issues. And we focused on some key, again, looking at childcare deserts, we focused on key zip codes to make sure that we increased not only the number of seats, but the access to these seats. And so there are a number of other smaller initiatives, but those were the kinds of things that we worked on. And the fifth and final, as I mentioned at the beginning, was the blueprint, the Maryland blueprint for education. And we've been monitoring that. We have played a critical role in the planning and the organizing around the county's blueprint strategic plan that is required by the state. But more importantly, lifting up the issues that are really critical for our early childhood community that may be unintended consequences of what's on the blueprint. And so we've been really active about lifting up those and hearing from you all what those issues are, what your concerns are, and lifting those up to the state level. So that's in a nutshell what the first 4 years were, and sort of what we were able to accomplish during those 4 years. And the focus. And we did do a lot of reporting back and letting folks know what we were doing, what the steering committee was doing, and having these periodic surveys as well as stakeholder sessions to make sure that we were on target with what folks expected us. All of this took money, and there was certainly significant investment. Kudos to the executive, to the council for annual investments into the Early Childhood Initiative to make sure that all of these goals, along with developing a whole 4-year plan. So I want to be really clear that we wanted to make sure that there was both action going on at the same time as planning, and that this wasn't a 4-year process of planning.
Right. So you've mentioned COVID a few times. You know, we all struggled through those 2.5 years, and I think we would be remiss if we didn't recognize how the pandemic impacted our childcare community. Unfortunately, over the past 2.5 years, we lost approximately 90 home and center-based programs. They had to close due to COVID. And that there was a significant decrease in program enrollment. And to this date, we're still averaging around 50% enrollment. It has made it very difficult to sustain optimal operation. The childcare model as it stands is quite challenging with just a single source of revenue to really, help with the operation of a childcare program. So now, while we are now on the other side of this pandemic, we recognize that these challenges continue in our industry. An important point, I think, to talk about is that during this pandemic, the initiative had to pivot from expansion to retention, and we had to address the multiple challenges. Can you share some of the work that has been accomplished during this time with the initiative?
Sure. And Jennifer, you're absolutely right. We had to pivot, and we had to figure out what role one end. I am so glad we had this initiative because we had already everybody at the table, and we could move much quicker than others who may have been trying to organize the work. It was already pretty well organized. We were able to get recovery dollars, relief grants out the door fairly quickly in what I hope you all found to be a relatively less cumbersome than normal in terms of the way funding goes out from government, because the emergency allowed us to do some things in ways that we don't normally do in terms of putting out grants and relief grants. So I think we put out close to $11 million worth of funding relief funds. We put out another $6 million in supplemental subsidies, for example, for childcare tuition. We put out another $1.5 million in PPE supplies. I again really applaud all of our folks who were able to initially put packets together and have you go pick them up from places so that you could get the PPE supplies you needed. But then ultimately we put in a system in place where those were delivered to you to sites. And so between the PPE supplies, the funding supplies, as well as making sure that we provided as much information as possible over the process we held. Jennifer, you probably remember more than I do how many sessions we had with providers in multiple languages, with the health department, with other folks, with the business support, to make sure that we were responding to the questions. And you had a lot of questions, and you had a lot of not unique to Montgomery County, across the country. We were hearing all of the sort of all the concerns about childcare. Do we close? Do we stay open? The needs of essential workers, and are we essential workers? There were lots of issues that we were constantly trying to bring to the answers to, or at least have a forum into having those conversations. We provided business consultation supports for many of the providers through some of our partners. I think, let me go back. I think we had about 360 information events totally, correct? I think that was our final count. And then we went to sort of the recovery reopening supports and really helping to reopen in public spaces, provide some of the supports, for example, rent relief for public spaces, for childcare in public spaces. That has continued to be one of the ways to help around sustainability. Lots of waivers around the equity funds, et cetera. So these were all over the last 2 years. and lifting childcare in the broader conversations of policy at the executive level was, I think, a very important piece, so that Department of Health and others really kept, and I give Jennifer and Barbara lots of credit for making sure that within the department, childcare was being considered and at the forefront. And I really do think that having the initiative in place really helped do that.
Agreed, agreed. It did make communication much easier. And to date, right, we have great relationships, which is nice to be able to move things and agendas along. So let's transition now to, we are now ready to embark on the next phase of this initiative, right, with new goals to meet new issues in our early care and education system. The steering committee has determined basically 3 broad areas of focus, right? Workforce, business sustainability, and supports for families, which are 3 extending topics from the first action plan. So can you share some considerations the steering committee has thought of within each focus area, workforce, business sustainability, and supports for families? Share some of the work that we're considering to our audience.
Well, again, part of the work and a significant part of the work is, are we right? Are these the 3 sort of high level areas that are important for the initiative to take on for the next 3 years? What are the issues within each of those areas? And is there another area that we've missed? And so as we think about what is happening nationally and what is happening locally, regionally, and locally, workforce really, we know there are a number of issues around the workforce that all of us are, whether you are a teacher, a center director, a family childcare provider, there are some key issues around workforce. I think the most significant one is around compensation. And compensation, and when I speak about compensation, I really mean the whole of salary, benefits, retirement, etc. The way I think we need to be talking about this is around parity. When we get to parity, how we get to parity, what does parity mean in terms of comparing or matching what we do with what public education does, obviously taking into account credentialing and so on. And I think a step towards that that really pushes us towards that is what the blueprint is on, right? In terms of pre-K. And that then means we need to really focus on our infant toddler teachers also, not just the pre-K piece, to make sure that they're not left behind. And so workforce is a very large piece, compensation, and all that goes with compensation is a really important piece. What does that investment look like? How do you implement it? How do you do that? And we're seeing in the region that that's beginning to also be a huge issue, and it is in some places already policies that are in place that may have a direct impact on the workforce in Montgomery County. And so we need to catch up to that quickly, and we need to put that in the forefront. So I think the workforce piece, it's also about retention of the existing workforce, and it's about recruitment. And so compensation, retention, and recruitment are really important pieces. And who are all the players that play a role in that? It is higher education, it is providers themselves, and what is it that they need and we need in order to do that? And are there ways for us to increase our access to certifications? Is higher education the only way? And then what is it that we need to advocate on behalf of the existing workforce and then the future workforce? So it's a big, big piece. The business sustainability, it's a continuation of what we've been doing. One of the things that we hear from family childcare providers, center-based, is helping really understand how to improve their business practices to make sure that they're sustainable. And so really business sustainability is a really key piece, because we know that unless your enrollment, your collections are really solidly in place, you can't make ends meet. As it is, it's very tough to make ends meet. So how do we make sure enrollment is in place and we're collecting the fees, and that those fees are really based on what the true cost of this care is. So, and I'll talk about it a little bit, some of the data that we're trying to put together in order to inform this work better. And then supports for families has to be to continue to increase our subsidies, continue to increase the eligibility, the reimbursement of those subsidies, so that families can access the care that they want, and make sure that we understand where we still have childcare deserts in the county, that we need to increase the access and the availability of space. So that's what we have been thinking about. I think totally open to thinking about the fact that there may be places that we have failed to recognize, and issues that we failed to recognize, and that's where we really need, like in the first 4 years, your input, your participation in sessions and in surveys, and then we want to come back to you and say, this is what we heard, and be able to then really delineate the actual outcomes we want in each of these areas.
So that brings up a good point, right? How do we start gathering this information? How do we engage with our community? Can you tell us a little bit about some of the plans that we have to be able to gather the information and utilize the data that we do currently have?
So there are three big pieces right now that were really part of the budget in the first 4 years. And because of the pandemic, we sort of slowed that down. And I'm glad we did, because I think they'll serve us really well right now. One is to do a supply and demand study for the county. And so you will be hearing about that. We have an RFP that is going out on supply and demand. The purpose of supply and demand, as from the name, is what's there, what already exists, where does it exist, what are the needs of parents, right? What's the demand? What, especially after the pandemic, how has that changed? What are parents asking for? Is it different times of day? Is it a different type of service? Is it more family childcare, more center-based, closer to work, closer to home, given the many changes in people's work schedules and work requirements? Are they working from home? Are they working from office? All of those kinds of things will really, I think, surface in a supply and demand study that will help us better plan and will help you. This is really about giving you a tool that will help you think about your own business and your own, where do you expand? Where do you contract? What are families generally saying within the county? So supply and demand, really critical. The other piece is a cost of care study. As you all know, most of the country still works on market rate, and market rate is not the real cost. And so a good cost of care study would get us to what the actual cost of this work is, and really inform reimbursement rates and inform the rates we charge parents, et cetera. And so that will be the second big piece. And the third piece, and we haven't mentioned it around the other issues, but it's a big piece, is facilities. Facilities are a key component of our work, as we know, whether it is increased rent or whether it is the need to improve our facilities. We saw a lot of that during COVID, having to make all kinds of facility changes that people had to invest in, but also if you're running a center and you want to open in another part of the county, or if you in the spaces that you're in, boy, I could put 2 more classrooms and that would make me break even. But I need funding to be able to do that. And we all know that means bathrooms, and bathrooms are very expensive. And so the idea is for us to have a fund, which has already been funded in this year's budget, to have what we call a facilities fund. So what we will be doing is asking for having someone help us put that together, and then asking for proposals from organizations that do this kind of work in other places, so that we will have a third party manage a facilities fund that you will be able to apply for. So I'm very excited about that. I think that's an area that is very much needed. It is not for major construction, but it is really for this part of either expansion and improving the facilities. We know from lots of studies and looking at assessments of programs that often program quality, where programs end up having some issues around quality, is around environment. And the environment is often around your facility. And so we want to be able to support you so that you can reach the highest levels of quality and then access other resources that are available for that. So that's the data gathering piece around this. And many of you will be called in, interviewed, etc., as this data is gathered, and all of it by third-party experts in the field.
Wonderful. Thank you so much, Bibi, for sharing all this information with our community and giving us this really broad overview. This really does conclude our overview of the Early Care and Education Initiative. I want to thank Ms. Otero for sharing and talking with us about the important activities that our county has invested in. We value your input and want to hear your ideas on how we move forward on our Early Care and Education Initiative. So as we had said at the beginning, this is part one. Part two is hearing from you. We'll be holding stakeholder engagement meetings over the next few weeks. This is your opportunity to share your thoughts on workforce, business sustainability, and supports for families, as well as some of the other topics that Ms. Otero had shared with us. Please go and visit our website, www.montgomerycountymd.gov/CCSS. and click on the link under training to register for our upcoming sessions. We'll also be posting to all our social media handles, so please visit us at DHHS-Early for more information about future topics. Again, thank you, Ms. Otero, for spending this time with us to share all the wonderful activities, and I wish everyone a happy day.
Thank you very much.